brought a couple of reference documents with me. So one is this wonderful book called The Acupressure Atlas by Bernard Colster, the front version as well with the hands. There we go. So it is right there. So it's almost on a par with Governor Vessel 3, very similar to what we did before, which is pressure down there for a minute or so. Hello everyone and welcome to my channel today. Today I have my model with me who is going to help me on my journey of relearning where all of the acupressure points are on the body, with a view to eventually covering as many of these as possible. So the first thing I'm going to do is cleanse the back, and then I'm going to do a contraindication check, because today what I really want to focus on is looking at the acupressure points for back pain. So I'm just going to pull down the blanket, and I have got the heating on so that my model remains nice and warm. Just going to pull that down slightly. I'm just going to cleanse the back first. Now this particular model has a sensitivity to creams and oils with scents in, so I am literally using micellar water so that it's nice and free from any fragrances. And then I will do a contraindication check today. It's not so important today because we're literally just touching acupoints, but it's always worth, when you're touching somebody's back, just to double check that there's nothing on there that could cause pain or discomfort to the client. So I'm just going to give a quick check, starting this side, just checking all of this out. And please do shout if anything feels tender at all. I know that you've got a couple of age spots here and a scar from where a mole has been removed, but we're not actually going to press on that area today, and it's all healed up. So nothing feels tender at all? Okay, that's good. As I said, we're not really massaging today. This is really just to see if there are any areas that I might need to avoid. Okay. Okay, that all seems fine. So, what I'd like to do is talk to you first of all, I think, about acupressure generally, because I'm really quite fascinated by the subject. So it was originally a traditional Chinese treatment based on the principles of qi, or energy that flows through 14 meridian or energy pathways in the body. And you apply pressure to various acupoints along these meridians. Sorry, start that again. So you apply pressure to various acupoints along these meridians to strengthen the flow of qi that I mentioned earlier, and remove any blockages that you have along these meridians. And this can really help to relieve pain and improve common ailments, and also help to promote a sense of overall well-being. Now, I studied this topic very briefly as an option on my holistic diploma course, but I'm still fascinated with it, and I never got to study it fully. So I'm really sharing my learning journey with you, and I've touched on some of the areas before, but I really would like to get more depth around some of these acupoints and slowly work my way round the rest of the body. So to help me do this, I've got a couple of reference documents with me. So one is this wonderful book called The Acupressure Atlas by Bernard Kolster and Astrid Waskowiak. And it's fascinating, it's very detailed, and it's very much broken down for somebody that is learning or relearning acupressure generally, and where these acupressure points are. And I will be using the pages associated with back pain today, so I'll be reading out some of those areas. And with it comes this wonderful acupressure chart. So we're looking at the back today, so I've got the back there, but there is also the front version as well, with the hands and the feet and the ears covered as well, with all the meridian lines on here. And these are the three main ones, and there's a little group here that we're going to look at as well today. So we'll study those in a little bit more detail. But it's really useful when you're relearning something like this. And obviously you can look it up online, but it's really helpful to have something that you can have next to you, whether it's via your iPad or your laptop, or indeed a good old-fashioned textbook, which I actually quite like. So this wonderful diagram that I've got here covers 361 points, so you can see that there's an awful lot to learn. The concept itself is based on beliefs from over 2,000 years ago, and acupressure is practiced by thousands of people worldwide, and is a way of relieving common aches and pains. It's not a substitute for medical treatment, but it can be complementary to this. And you do need to be aware that caution needs to be used for those people who are pregnant or have cardiac issues, because it can overstimulate certain areas. So always check with your medical practitioner first. But an acupressure point is a point of increased sensitivity located along these meridian lines that I mentioned earlier on the diagram, and there are 14 of them. So I'm just going to run through the ones that. So I'm just going to run through the names of the 14 main meridian lines. So you've got number 1, which is the lung. You've got number 2, which is the large intestine. You've got number 3, which is the stomach. You've got number 4, which is the spleen. Number 5, which is the heart. Number 6, which is the small intestine. Number 7, which is the bladder. Number 8, which is the kidney. Number 9, which is the pericardium. Number 10 is the triple warmer. Number 11 is the gallbladder. Number 12 is the liver. Number 13 we have the conception vessel, and number 14 is the governing vessel. And as I mentioned, there are 361 acupoints along these meridian lines, and these specific acupoints have the most wonderful names. I mean, how people memorise these, I don't know, but some people do. But today we're going to just be looking at 3 of these. So we're going to be 3 main ones, sorry, and then a small group that are located on the lumbar spine. But for the main ones that we're going to be looking at, it's a governing vessel 3, which is known as lumbar yang pass. Governing vessel 14, known as great hammer. And the gallbladder 30, known as jumping round. As I said, they have the most amazing names associated with them, and I have great fun looking at some of these. They also have Chinese names as well, which I won't even attempt to pronounce, but these are the Western ones that have been given to them. And then we're going to be touching on the lumbar spine area, which we're going to be warming up, and the sacrum region as well, where people have a lot of their pain. So what I want to start off with doing is just reading out a little bit of the reference material so that you get a feel for how I'm relearning all about acupressure. So they say the most common cause of back pain is bad spinal posture. Even in children, damage to the spine from a bend to one side or to the frontal back is not rare. The nature of leisure activities has changed, and both children and adults now spend the majority of their day in a sitting position. As a result, the muscles that support the spine are not used sufficiently and begin to atrophy. At the same time, the muscles of the buttocks, neck and shoulders carry an excessive burden that often leads to tension and pain. Sometimes even small movements initiated from a bad starting position can be enough to cause an unbearable pain in the lower back. This condition is known as lumbago, and it's characterised by pain in the lumbar spine. In Western medicine, back pain, including lumbago, is frequently categorised as functional, meaning that no organic cause for the symptoms can be detected. And indeed, you can often hear about people going away for tests and they can't find anything. And what they're saying here is really look at how you're sitting and what you're doing. So what can you do? So all activities that strengthen the back help prevent back pain. So learn behaviour that is good for your back in everyday life and make a habit out of it. Many physiotherapists and even community centres offer courses on improving back strength. And if you experience lumbago, warm, damp wraps and a hot bath can alleviate the acute pain. Obviously, make sure that you consult your physician as soon as possible if you do have severe back pain. So, how can acupressure actually help with this? So, in contrast to our Western experience, traditional Chinese medicine sees wind and cold as the most frequent causes of back pain. These two factors are the focus of acupressure treatment, especially in the case of sudden onset pain. Massage of the points, which we're going to cover, is helpful in alleviating back pain, and a successful course of treatment also includes rubbing the lumbar spine and warming the sacrum region through rubbing. Please note that governor vessel 3 must not be massaged in the case of pregnancy. Okay, so what I'm going to do first is look for the first major acupoint associated with back pain, and that is governor vessel 3. As we know, that's lumbar yang pass. And this point is located over the lower spine below the fourth lumbar vertebrae. Feel for the upper edge of the pelvic bone and locate this point at the level on the spine. And I have my wonderful diagram to help me as well. So we're going to go down the back and we're going to locate that, which is about here. And then it says you massage the point with the tips of your thumbs, applying steady and then circulating pressure, first clockwise and then counterclockwise for 1 minute each. So we've got that here. Yes. So you put pressure and then you circle clockwise. And then counterclockwise. Obviously that is not quite a minute each, but you get the general gist from that. And then you rub that area with your palm for up to 3 minutes. And you can imagine if you are suffering from back pain, the relief that this actually gives is really nice. And if you think it's almost sort of in the middle of the back, this book is so good because it actually gives you some diagrams to follow as well, which is very helpful. So then the next point we're going to look at is governor vessel 14, known as Great Hammer, and that is located on the spine between the lowest cervical vertebrae and the top thoracic vertebrae, so it's up at the top here. And I've got my other diagram here. So 14 is, let me get down from the head. There we go. So it is right there. So it's almost on a par with governor vessel 3, governor vessel governor vessel 3, but obviously towards the thoracic area. Okay. It does say sometimes it's easier to locate it by bending the head slightly forward, which we can't do now, which causes the dorsal process of the lower cervical vertebrae to protrude slightly, and governor vessel 14 is just below that. So again, we're going to do very similar to what we did before, which is pressure down there for a minute or so, and then you would do clockwise movements. And then anti-clockwise movements as well, but for a minute each of those. And then you would rub the points and the skin around it with your palms for about 3 minutes. And that's just to relieve the feeling of the pressure and to really warm that area up. It's really fascinating. Right, over the page, and we've first of all got the rubbing of the lumbar spine. So at the level of the upper of the pelvic bone, rub from side to side across the back with the palm of your hand, applying slightly stronger pressure when you're moving your hand away from yourself. So I think what they mean is very gentle in the middle and then more pressure. That's it. More pressure when you're moving away from yourself there. That's it. There we are. Got that. And that is really designed to warm up that lumbar spine area. They've got some wonderful visuals in this textbook which really help you understand what you're doing. And it does say continue that for 3 to 4 minutes. And it creates a pleasant warmth on the skin. Okay. Then our last main point is gallbladder 30, known as jumping round. So gallbladder 30 is, actually we'll take these two off because we've done those two. Gallbladder 30 is right at the bottom here. So gallbladder slightly to the right of the spine, and it's right down there. Okay, and it said it's easier to locate this point with help from your partner or your therapist. Okay, imagine a line running from the bottom of the sacrum. Okay, yeah. And if you do the line, okay, gallbladder 30 is located in the spot that divides the middle to the outer third, so that's just about here. So rub these muscles for 2 to 3 minutes with the balls of your hands, moving your hands from the middle of the body across the large muscles to the outside, and then less pressure back to the middle. Then massage gallbladder 30 for 2 to 3 minutes using steady and then strong circular pressure. And that's back with this. First clockwise and then counterclockwise. And it does say here this needs to be quite pressurised, but I would just take great care. You need to really keep asking the question whether the pressure is too much, because some people who are not used to doing this can push really hard. So you want to measure through communication how much of that pressure you want to use. And then we've got the warming of the sacrum, so slightly further down from where we were before. So the points urinary bladder 27 to 35. Now on our wonderful diagram, 27 to 35 is like this whole group at the base of your spine there. It's a whole group of acupoints all in that area that need doing. So rubbing the area activates these points. This massage is best done by somebody else. So, okay, rub from side to side across the sacrum with the palms of your hand. Make sure that your palms remain in steady contact with the skin, which is necessary to create a warm sensation, and massage the sacral bone in this way for 4 to 5 minutes. So that's actually quite a long time. Feels like this is a workout. But that will really warm up this area. Now with many of these you can do it without clothes on or with clothes on, or maybe if you're going to be poking around on the back you can clear the back but keep the rest of the body covered. Many of the diagrams here show people in various states of dress or undress, so it's whatever suits you and what you're comfortable doing. But I just find the whole concept of acupressure just totally fascinating, and I really want to continue learning more about it. So next page is on tennis elbow. I'd be really interested in looking at that one later. Okay. So hopefully that's given you a little bit of an insight into what I'm doing at the moment, which is relearning about the whole of the acupressure setup as a complementary therapy, and totally fascinated by some of not just the history but where you can actually feel some of the pressure from these points that you're putting pressure on, and you can actually feel the reaction in your body, because some of this you can do yourself, some of it is helpful to have a partner to do it with. But by learning where the acupoints are, you can build up enough knowledge, I think, to provide a good acupressure treatment. And as I said, this has been used for years to really help get these energy lines clear and deal with some really common issues that we all suffer from. So that brings me to the end of this session, which was all focused around back pain, but also focused on my fascination with acupressure, and I hope to build up my knowledge of this over the next months or so, so that I can eventually give a full acupressure treatment. But as an enhancement to well-being, I think it's a good complementary treatment to have. And I hope that you have enjoyed this introductory session. So thank you so much for watching.